today? I'm happy to be with you. Talk about the very first section of the narrative, the introduction. So, let's take a look at this section. So, what you'll see throughout the next 2 days is, for when we talk about each of these sections, there's a screen like this in front of each section that we developed. And it tells you what part of the reviewer's criteria this belongs to, which is need, how many points that need our test matrix worth, and then the recommended number of pages, which Mike went through a pretty intense process to kind of calculate this, and I think he'll show you that tomorrow. And then also a part on here that shows if there's any attachments that are required for this section. So for the introduction, there are no required attachments, but you can attach something else that you feel is relevant. So be looking for these screens. So section 1 introduction is called need for the reviewer. So let's look at what that means. So it says the extent to which the application demonstrates the problem and associated contributing factors to the problem, the needs of the state. So basically, why do you need this grant? Okay. So you're trying to demonstrate a need for this program in your state. Okay, so from the FOA on page 23, this is not the reviewer's criteria. Now this is what the FOA is telling you should be included in the introduction. So it tells you to briefly describe the state's healthcare system and the purpose of the project, the reason why you're doing the project. And then it also states to include other information to describe the healthcare system and the prevalence of pediatric illness and injury, as Cynthiana mentioned. Okay, so a couple things to think about when you're writing throughout the next little while, or making an outline, is how does what I write relate to EMSC and my application? Okay, so you're always trying to think back to EMSC. How does it relate to EMSC? And how does the information I share affect the care of children? Okay, so this is kind of your overarching goals. So keep those in mind. Okay, so what I did is I went through the review criteria and the section in the FOA that describes what the introduction is, and I made a suggested outline. Now you don't have to use this outline. This was just a way that I took all the information and figured out maybe how you could group it in a simple way. So you could start with a really short introductory paragraph. Then you could include a subheading on your EMS system, because it asks you to describe your healthcare system, the EMS and the hospital system. So that could be your next subheading. And then you could have a subheading on the prevalence of illness and injury in your state for pediatrics. And then finally you can transition to the next section. So this is just a suggestion. You also can read both of those things and try and figure out how you would organize it. Okay, so here are some ideas for maybe an introductory paragraph. So I know this has been stated a lot already, but go straight to the point. Try to avoid rambling. So think about, when was your program established and why was it established? The why helps define the need for your program. So the why is important. Okay, your purpose or your need in applying for the grant. Why does my state need this? Make sure you mention performance measures right up front in the introduction, because that's a big deal. And then you also, I think it's helpful to include your state's pediatric population, because it helps set the stage for what's going on and how many kids you have in your state. So the introduction is really the part where you're trying to reel in the reader and get them interested in your grant. So you want, even though it's worth 5 points, it's really important because it's the very first thing they see from you. So if the reading goes in the wrong direction, they could start thinking this could be a painful experience to read this grant. So you want to get them excited to want to know more about your state. So I tried to work through an example, maybe a possible opening statement. And I tried to pretend I was you. And what I did is I took Lenora's suggestions and I broke down things topically and I wrote down little ideas. So here's something you could do. So you could start out with when you were established and why. So in order to institutionalize pediatric emergency care. I think that word was in the FOA, and it's important because that's our ultimate goal. So you could state something like that, and then you could say, we've loved focusing on the EMSC performance measures, because I know you all have loved it. Then you could say, our goal is to improve the emergency care for children, ensure that proper medical care is given. Again, that's a need. I want to ensure that the care is given. So these are just examples. And then you could mention the pediatric population. And this population relies on the system. Again, that has to do with the need. So again, trying to tie all those together to demonstrate the need. So then if you move, so that was just a really short example. Your introductory paragraph may be a lot longer. But if you move to the next section on EMS system, and I love this joke, hopefully you all get it. What did the paramedic say to the stroke patient with left side paralysis? You're going to be all right. I love it. Okay, sorry. Yeah. Okay, so from the FOA, there are some suggested statistics. That doesn't mean you have to require them, but I'm assuming if it's suggested, it's probably important that you do state them. So I broke these apart into these different systems because they were kind of listed in a various order. So they asked for the number of EMS agencies, the number of EMS patient transports, and how many were for pediatric patients. So tell me, where could you possibly get this data? This is data.
This is a challenge for my state. So it's easy for me to say that I know my agencies, but our agencies can't even tell us how many transports there are, and I would have to tabulate every single agency by hand, because we do not have electronic data collection in the state. Yes. Now I can tell you how many pediatric patients come to my emergency departments, but that's not going to capture my EMS.
Well, what you could do is state nationally a percentage. By saying Arizona does not yet have a fully complete data system to analyze this, but nationally, NEMSIS data estimates 10% of all EMS runs are for children. You could state something like that. Other ideas for Tommy. What if you don't have access to these numbers for your state?
IOM report.
The IOM report. It has information on the transport kids. That's true. I would go ahead and state something nationally. Yeah.
I'd probably use national too in a way, because our key transports are so low, it would probably not be that impressive. And you don't want to make it sound like, why are you have to grant people, because it's not very many.
Lenora, you look like you had a comment on that.
Well, my comment to that, quite honestly, because sometimes I feel like I'm still really a new program manager, I'm really, really happy to see that EMSC is going beyond the EMS agency and is looking truly at the system that is inclusive of hospitals. Because in my state, our EMS bureau and many of our agencies, EMS stops at the ED door. So the way this is set up, this is now looking at the system. So having low PEDS EMS transport numbers, we get, but capturing the total PEDS population that's accessing the emergency department just really makes us have to refocus on what really it is.
That's true.
The issues are.
Yeah, who's showing up at the ED? Lenora, what were you going to say?
Carol, I'd just be concerned that if you gave national numbers, the reviewer's going to say, well, what's happening in Wyoming? Don't they know their state? So you can always use national, or you can say similar to national, we have 10% pediatrics. Our runs every year are, but I would try to obfuscate.
To minimize
That's true, use percentages that.
You can do that, but I don't think it's, your number might seem low, but you have a big, large state. So I think you need to really talk about it that way too.
Right, I mean, the children are on the I-15 corridor. There's a place where it would take hours for paramedics to get there. Yeah. could always describe that information. So
US
Hannah,
I have the same problem for different reasons, maybe, but they tend to be political. And what I look at is, as we said earlier, changing the politics of services, more collaborative and less silo-based. So put it in as an initial barrier, but look at creating those relationships that give us the numbers we need outside of the EMS.
to build partnerships. That's a good point. What were you going to say, Elizabeth?
I heard it behind me, somebody said IOM report or IOM?
IOM, the Institute of Medicine.
Oh,
Yeah, it's been about 8 years ago, I think.
Future of Emergency Care is a great resource, and we need to have all members to write the bill. It's a great way to start.
Yeah, was it 8 years ago, Mike? I think.
Or
It's
more.
Six.
But there is, if you go to the Institute of Medicine website and look for growing pains, then you can find the picture. Now,
Example,
yeah.
another idea could be really narrowing it down state-specific EMS ABCs and EMS patient transports is difficult. Another way to be able to convey the need is looking at the Census Bureau numbers and population and using the national averages to estimate what you think it looks like in your state.
Right, that's a great idea. I mean, we know from NEMSIS that approximately 10% of runs for pediatrics. So T's saying if you can look at the census data for how many children you have possibly in your state, you might be able to estimate, we estimate that this many transports of your children. It's a good idea. Tony?
Yeah, there's a great article in the Pre-Hospital Emergency Care from 2008. It's Epidemiology of Emergency Medical Services Used by Children. It really talks about not only how often children use EMS, but how it affects the acuity level when they show up at the hospital and those sorts of things. And I think it'll help answer all of those questions too.
tell us
Can
again.
you email that?
Yeah, I'll send that link out.
Oh, great, thank you.
And one other thing with low numbers, I mean, you just turn it around and say that's a weakness because EMS then doesn't get the practice, the repetitive practice of caring for children.
So
Therefore,
they're not always prepared.
there's a need for blah, 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 blah.
Yeah.
In fact, at one of our workshops, Craig took that 10% and broke it down. And what did you actually find, like a week
Well,
or a day?
depending on the runs per station, you break it down. And basically, I mean, if you run X amount of calls in a month for a platooning system, that it can basically come down to two or three calls, go around shift that are going to be pediatrics. And if you can take it from this level up here, that one particular agency runs 2,000 calls in 6 months, then keep breaking it break down. It still gets down to that 10% call, but if they're running 10 calls a day, well, those going to get taken.
They're going to see.
Or if you have 128 calls for the year, you can break it down to how often would one EMS provider even encounter a child per
Right.
5 years.
Yeah.
Yeah, I mean, what Craig did was actually pretty shocking because once you saw the number, it was like, wow, they're seeing kids every day. So it was pretty, I mean, maybe you can meet with him after and see how he did that. But sometimes we think 10% isn't a lot, but when you look at it, it's actually more than you think.
But I think Jen's point is good. Use this needs assessment to start setting up the rest of your application.
And, oh yeah, go ahead.
Could we, I don't know, just thinking here, ask maybe the reviewer, whomever, a rhetorical question of what if it were your child? How would you feel about, your medics being prepared to handle this emergency or their lack of preparedness? I'm just thinking out loud here, a rhetorical question in your narrative or in your introduction? Yeah, no, maybe?
I'd be hesitant to do that myself, but if you feel comfortable that
No,
way.
I'm asking, I'm new.
I mean, Lenore probably has the most experience.
No, I think Renee and Janet can.
I wouldn't do
Flip
it.
and say, one child is still too much, the loss of one child is still a
Okay,
tragedy
okay.
to some family.
There you go.
Rather than asking that as a reviewer,
Yeah.
put it twist it as a statement.
Excellent, excellent.
That could be
Okay.
the topic sentence for a paragraph if
Yeah.
you wanted. You could start with that. one child who is not making it is too many in our state.
Right.
In our state, we have the da-da-da, so you could use it that way.
Also, IOM, what were the other, tell me, what were the other resources you
Well,
mentioned?
it's the Future of Emergency Care. Was an IOM report, but it's 3 books.
There's 3
One is specifically focused on children and pediatrics, one is focused on the EMS system, and one is focused on the emergency departments.
Future of emergency care.
I think you can buy it, to
Yeah.
download online.
You can
right?
download free, or you can buy the books.
Yeah, you can get the PDFs for free online. Yeah.
Thank you.
The other thing I was going to say, how many of you are submitting to the NEMSIS data set, your state is? Okay, so maybe a third of you. I did talk to Karen Jacobson, and if you want to contact her, she can look up and from your NEMSIS data that she has, how many of these patient transports. She did offer, if you want to contact her, she would look that up. So through the NEMSIS data, you can calculate this. Okay, so here's some ideas that we had. If you don't know, you could contact your EMS data manager, find out if they know. Some of the information you can get from your 2010-11 performance measures, because you know how many agencies you surveyed, and if they were ALS or BLS. You could also go to your bureau or look at state-level NEMSIS data. So a possible example of how you could write this new subsection is state, first of all, it's talking about your system, the EMS system, state who administers it and through what branch, and then go right into the numbers. There are currently 170 agencies located throughout the state. Of these agencies, 70 are basic life support and 100 are advanced life support. So these two numbers, they didn't ask for, but it says in there you can give supplementary information, and you might have that from your performance measure data. And then on average, EMS transports so many patients every year, and last year 57,000 transports were for pediatric patients. So just an example if you have that information. Now again, you might have to tailor it differently depending on where you get those numbers.
I actually like the way you put the big number out instead of 10%. The 57,000.
57. But it makes a difference when you see a number. Okay, so you can also, while you're in this introductory, tie in performance measures because it can describe your system. So you could talk about 71 and 72. Explain how medical direction is used in your state, who provides it, and also talk about your protocols. You could say we have delivered them to all of our agencies to make sure that care is consistent. So you're addressing those performance measures. And you could lead into the next section that Andrea's going to talk about and say, for the most part, we're prepared, but we did identify some deficiencies through our surveys that we did in the last couple of years. And that will be addressed in the next section. Okay, so then you will want to talk about your hospital system. So again, remember, these examples are just super compressed ideas. So yeah, 1 minute she was eyeing her hospital bill, and the next minute she's going to the hospital. Okay. So these are some of the suggested statistics that were in the FOA, as Tony mentioned. The number of hospitals, and it does say to include critical access hospitals, and the number of emergency department visits and how many of those were for pediatrics. And in the FOA, it does say pediatrics are 0 to 18 years. So where would you find this information?
That should be provided on statehealthfacts.org for that.
Okay, hold on.
Yeah, if your state submits to the HCUP database.
HCUP. If you know who's submitting that, where that data is, that could be.
Their division of injury and violence prevention, well, South Carolina has that, other states have.
So your division of injury and violence protection have information on the number of children going to ED. Wow, that's a great resource. I didn't know about that. Tell me, what were you going to say?
Well, I'm just agreeing with her because I'm that person, and we're required to see the number of emergency department visits.
For children.
Well,
For all children.
Your state vital statistics. is
The
what-
vital
is
statistics.
what State vital statistics.
Okay, state vital statistics, good joke.
Well, hopefully. I mean, we are now able to capture ED visits, but prior to the middle of 2009, we were not. So some states may not have all of that stuff.
26 states do not do require emergency permits to record the data.
Oh, wow, 26 states to move. Any other ideas for finding this data?
Your cost of Office of Research and Statistics in the state.
Oh, Office of Research and Statistics, good, they found that.
Your hospital association.
Hospital Association,
May.
hopefully they know something about that, would be helpful. So these are just a couple that we thought of. The State National Hospital Association, your data manager again, maybe they have some information on this. You can, from NEMSIS, look at it from a point of view of how many children were transported to a hospital. So you could look at that, but you're not going to get the ones who showed up at the ED. Statehealthfacts.org, it does, if you go here, this was a website that Amber found, it does list the total number of emergency room visits for each state, but it doesn't necessarily break it down by pediatrics, but it could be a starting point for you if you go to that website and poke around. Okay, so maybe some example writing for the hospital system is just to go straight in and explain it. There are 47 hospitals, 2 of which are critical access facilities. And these facilities are located in highly rural areas, probably because that's why they're critical access hospitals. So according to Utah hospital data from 2009, so even if you can't get the latest, make sure you cite where you got it from. Approximately 2.1 million individuals visited an emergency department of those. So this is a different way of writing. You could put the percent and then say the number, and then say children ages 0 to 18 years. And this could be an opportunity to mention how many children's hospitals you have, because this explains your hospital system in relation to children. And then again, you can tie it into performance measures. So if a child needs a higher level of care and they need to be transferred to specialized hospitals, most of these hospitals in our state have interfacility transfer agreements, because you have that number, but are lacking some critical transfer guidelines. We know that from the national numbers that most of you have agreements, but not everybody has guidelines. And again, you can say, I'm going to talk about this in the next section. So the other 45 hospitals will be assessed as to the current state of pediatric readiness. So we know that 2 of them were specialized children's hospitals. You could just talk about the pediatric readiness, how you could tie that in to this, because that's also mentioned in there, that you can use pediatric readiness to assess how hospitals are going to treat children. Okay, so pediatric illness and injury. This was an interesting one for me. So it says, what are the 5 common types of severe injury and acute illness in your state? Where would you find this information?
Here's the Children's Safety Network.
Children's Safety Network, right there.
Their information.
Which was started by Stephanie Brin, is that right? Lenore, what are you talking about now?
Well, she was the federal officer for
One of the beginner.
Sue Gallagher started it.
So maybe you could contact Stephanie Brin at the NRC, because she was highly involved with that. Other
You could
ideas?
always sign
Yeah.
up to others.
Doesn't the, your Healthy Kids book by Robert Wood Johnson, and I know maybe the wrong word
Annie
there.
Casey Foundation.
Yeah, that's it. They also have breakdowns for your state, and where they get that data is probably, should become your best friend within your state, because they get it from your states, and they have states.
So what is the name of that
That's the
report?
Healthy Child, it's not, that's
It's
not.
something
It's
like-
not-
You see the kids count?
Yes, yes, count from the Annie.
Annie E. Casey Foundation, state by state.
The N what?
Annie E. Casey, Casey Foundation. You can look it up on.
Annie Lee Casey?
Foundation.
Ah, okay.
I think it's, I think that's no state.
called Kids Count, I'll look it up.
Yeah, it is.
Okay.
So this is a report for each state? Yeah. Okay, never heard of that. That sounds good. Where else?
Maternal child services.
MCHB. Okay. Good. Okay, so I had a hard time, I just went out and tried to find this information for Utah. It was a little bit harder for me to find because I don't have some of the connections you do. But again, you could try your data manager, see if they know what types of illness or injury are coming to EMS. You could check with the Level 1 Trauma Center, see what types of injury or illness they're seeing. Your state health department, your injury program. Vital statistics, you can again look at EMSC to see what it does list types of injury that are being reported and different types of illness. And these are some other sites that I found. They don't always say specifically for your state, but they might help get you started down the right track to find those numbers. Yeah, Joe?
You might add state trauma registry to that list.
State trauma registry. Good, okay, so write in state trauma registry. So if you did have this information, here's possibly how you could write it. In Utopia, the 5 most common causes of severe injury are, and state them, and state where you got it from. And here is a great way in your introduction to tie in the FAN rep, because this is a great place to use the FAN rep, is in injury prevention, right? For when you're talking about causes of severe injury. So you could say many state programs have been established to help prevent these injuries, and the EMSC Family Advisory Network established has been invaluable in sharing prevention tips and data with the community. So talk about what, if your FAN rep has done things to help you with injury prevention. Okay, so what about illness? So this was a sample I looked up at the NEMSIS data that about 58% of EMS runs involving children are due to acute illness and injury, or acute illness only, sorry. And then you could say the most common causes are, and list those again. And it's always nice to show what types of relationships you've built, again, to give context to the reader. That the EMSC program has developed relationships with Utopia's children's hospitals in order to help spread awareness of seasonal flu and respiratory illness, such as asthma. And then if you have a targeted issue grant that has to do with your hospital system, mention it here because it shows your investment in EMSC. So one of our children's hospitals currently has a targeted issue grant to study the incidence of asthma in urban areas, so you can state something like that. Okay, so you're moving towards the end of this section. So, yeah.
I have a quick question. And this may be better for you, but has the definition of acute illness, what particular disease processes are you looking for? Because I can pull the top 5 illnesses.
Sure, acute is a key word.
Acute, yeah. From an emergency department perspective, you typically don't pick that up off the ICD-9 codes.
Say that again?
You don't typically pick that up off the ICD-9 codes unless I go into my hospital discharge data to see who's been actually admitted.
So how would you define acute? Does it have to do with mortality?
Do I want the top illnesses? What are my kids being seen from the emergency department?
Well, because the guidance does specifically narrow it down, I would think of it as this is your way to present the need and these are going to be your focus. You know, it's the reason why those are the key areas asked by most common is because where's your concentration of your program? You know, this is where if you're going to focus, like she mentioned, on asthma, you have a targeted issue grant, so I'm sure there's strategies and activities related to that. So where would you see you could demonstrate the greatest need? In which area, acute or just the 5 common illnesses? Because we didn't specifically state that.
So you're saying looking at
Unless I'm wrong.
data in relationship to what you're going to focus on.
As you're leading into it, because You're really not necessarily going to focus on asthma, but you're trying to show the reviewer that you understand the needs of your state. And this is what we're facing at this point. Or according to the most recent data, this is where we are struggling. Should we focus on pediatric education in these areas for our EMS providers? Because this is where the most common need is. The 5 most highest incidences are in asthma. Should our EMS providers be trained on proper intervention for asthma? Just connecting the dots.
Just as you're introducing
Connecting
your
the
group.
dots, yeah.
Other ideas on acute illness?
Yeah. Where did you find acute illness? Would you go to like childhealthdata.org or the hospital association, or what ideal place has acute illness information?
Ideas for Elizabeth?
It's going to be listed out, so, you know, when you're looking at your data for your hospitals and emergency departments, you're going to have asthma, you're going to have falls, you're going to have fever of unspecified origin. So that's why I come back and say, is there anything specific that's being looked for, or do I just take whatever I have my data ran for? From an injury perspective, you know, falls is the leading cause of injury to kids, and that's why our emergency departments are seeing. Abuse may float to the top as well, maltreatment.
I know at the last workshop, somebody really suggested going to their trauma one of the hospital and saying, what types of acute illness are you seeing here? And you could look at it by, I know somebody mentioned looking at it by mortality, like these are the types of illnesses that children are dying from, the top 5. Or you could also say the highest prevalence. It depends on how you actually translate that word acute.
That's why, because by statistic, we think it's death, and if you're death occurred, but acute, I think it's something that probably isn't considered for that.
Right. I would find out whoever collects your hospital data, number of people that come in, that, you know, whoever does that whole basket of stuff, and then they'll drill down on the pediatrics.
But T is sounding like to me that you're not necessarily saying it has to be what they're dying from.
No, it's what I interpret that as what they're most often coming to emergency department. Or the most EMS runs.
Right.
Than the number.
Seizure of Titus media.
All right. Other questions on?
Because, you know, the other data source, if we're looking at death, is, you know, if the state has a child death review process, then those teams are going to know what your leading cause of mortality is.
Death review, okay. Child mortality death review. That's a good one. You could add this section too. Okay.
I haven't dug through it much, but the CDC has an injury and violence prevention and controls section.
Yeah, Whiskers has a lot of information. Again, you have to kind of figure out what it is. You have to run your own little queries, so you have to think about what you want. Yeah. So let me get back to where we were. Okay, so if you're going to transition to the next section, you want to set the reviewer up to just continually read, right? You don't want to abruptly shut them down. So an idea is, in order to understand our system, especially for children, we participated in a needs assessment, which was really the survey, right? But throughout your FOA, you want to use the word assessment and not survey. We're hearing that more and more, well, right now. The person wants to use the word assessment. And then you can say the next section will provide you with results of this assessment. And move on. Okay, so a couple writing tips for this section again is try not to ramble, because sometimes we can go on and say, and we have our state is 100 miles by 200 miles, and the highest building is, and we're at this altitude, right? You don't need to say all that. You're just talking straight to the point of the needs of the kids and how your system runs. Okay, so same thing, be brief and to the point. So, how are we on time for lunch?
Half an hour.
Okay, so I want to encourage you, so last time, I was going to use my hand to erase, we'll use this. I just want to point point out again an idea for doing an outline, because I know last time after I talked about this, some felt like they had to jump in and write something. So again, when you're doing an outline, if you decide to do it as the way we suggested, you don't have to. You can find a different way to group it. So if you had your intro, your EMS system, your hospital system, and your illness and injury, I would start like this. This is my outline. I have 1, 2, 3, 4, and then the 5th one was your transition. So start your outline here and then start putting ideas underneath here of what you know. Right? I'm going to say where and why established, number of agencies, and then after you take these, you can start to form them into sentences using the tool that Lenora presented you. So that can be a really helpful tool, and that's why it's on your jump drive, is you can create an outline and then go to what Lenora showed you and try and pull it together into sentences. And then you just put those sentences together into a paragraph, and you got it. But hopefully, when you leave, you'll have some idea of what you're doing.
Thinking about other projects, like for instance, children's special health care needs, identification projects, injury prevention or disaster preparedness. Think about areas where you want to place that in your, so that it all leads and it all connects. It's not just an afterthought where the reviewer would be like, you didn't even, where did this injury prevention project come from? You know, just an added
So tying
goal.
in those projects into these areas
Think about where it can
as they fit.
if that's the area direction you want to go back to, because I'm used to focus on these things.
So if you were going to write something about that you're helping your hospitals with disaster preparedness later on in your grant, you might want to set it up here that currently 2% of hospitals have a disaster plan for children.